कोरोना मरीजों की तादाद में 5 रोज के दौरान तशवीशनाक हद तक इजाफा सामने आया है, जिसके सबब नेशनल कमांड एंड ऑपरेशन सेंटर का इजलास आज दूसरे रोज भी होगा। हुकूमत पंजाब ने कोरोना के बढ़ते केसेस के सबब सूबे में मुकम्मल लॉकडाउन पर गौर शुरू कर दिया। लाहौर के मजीद 27 इलाकों में स्मार्ट लॉकडाउन नाफिज किया गया है। मास्क न पहनने पर गुज़श्ता रोज पहली FIR भी दर्ज कर ली गई,
जबकि निजी बस स्टैंड सील किया गया और खबरदार किया गया है कि SOPs की खिलाफ वर्जी पर 6 माह कैद की सजा भी दी जा सकती है। फैसलाबाद के 19, गुजरात के 4 और मुल्तान के 4 इलाकों में भी स्मार्ट लॉकडाउन लगाया गया है। फैसलाबाद में कबड्डी मैच के दौरान SOPs की खिलाफ वर्जी पर कार्रवाई की गई। इस दौरान तमाशाइयों ने पुलिस पर हमला कर दिया। 20 अफराद के खिलाफ मुकदमा दर्ज कर लिया गया। नेशनल कमांड एंड ऑपरेशन सेंटर ने कोरोना SOPs की खिलाफ वर्जी करने वालों के खिलाफ सख्त क्रैकडाउन का हुक्म दे दिया है। वैक्सीनेशन की कम शरह पर तहफ़्फ़ुज़ात का इजहार किया गया है।
Well, every day you're seeing developments and measures put in place that really drive home the impact that this outbreak is having on Iran and ordinary people. Today, the development was Iran's national carrier, Iran Air, suspending all flights to and from Europe. Other carriers have done that as well. As we speak right now, the only global carrier that's coming in and out of Iran is Qatar Airways, based in Qatar. That's one development today. The other development is authorities in 15 out of 31 of Iran's provinces banning all non-locals from traveling to the province. In other words, if you're not from the province and you're trying to go to that province, authorities are going to turn you back and tell you to go home. This is seemingly an effort to stop the spread of the coronavirus. We have seen some social media posts where fights are breaking out between locals who seemingly see people with license plates from other provinces and they don't want them to be there. We should point out that we have not independently verified these social posts, and we should also point out that based on our observations, the overwhelming majority of the people that we're seeing here in Iran are dealing with this outbreak in a civil and cooperative way. Sure, they're scared, they're concerned, but they're helping one another. They're taking precautionary measures. They're not going out to social gatherings. They're doing the best they can in a civil manner. And keep in mind, in less than 2 weeks, it's Nowruz, the Persian New Year, perhaps the biggest and most popular national holiday where Iranians get together and socialize with friends and family. That's not going to happen the way it usually does. Another hit to this country that has seen many crises over the past couple of years.
Yeah, and Reza, I'm imagining the Iranian health system is under enormous pressure, given that Iran has become a hotspot country for the coronavirus. Are the hospitals able to cope?
You know, it's hard to say. We've talked to some hospitals and they've expressed confidence that at this point they have the capacity. But again, this is an unprecedented event. And observers say no matter what country you are, you're going to have a dealing with this outbreak. Iran obviously has its critics. Many say Iran mismanaged this outbreak, that they didn't reveal the severity of it when it first came out. But others say U.S. sanctions, crippling U.S. sanctions, have also had an impact on Iran's public health sector. Washington says sanctions do not impact humanitarian trade, but many here say they have. So difficult situation all around.
59,118 new COVID-19 cases in the last 24 hours. Now, this is the highest daily caseload that has been recorded this year. The number of daily cases has been on a steady and constant rise in recent days, and it appears that another wave of COVID-19 is now looming in the country. The health minister said that variants from UK, South Africa and Brazil have been reported in the country, and the local government is expected to carry out measures to curb the spread of the infection. The Indian government has also ramped up testing facilities across the country, and according to the Indian Council of Medical Research, it has conducted more than 238 million tests so far. And as India witnessed a sharp rise in coronavirus infections, former Indian batsman and captain Sachin Tendulkar confirmed that he too had tested positive for COVID-19. Furthermore, he now has mild symptoms. Taking to Twitter, Tendulkar said, and I quote, "I have quarantined myself at home and I'm following all the necessary protocols. As advised by my doctors, I want to thank all the healthcare professionals who are supporting me and many others across the country. Take care, all of you." That was what cricketer Sachin Tendulkar recently said on Twitter. Now, to combat the increasing number of COVID-19 cases, Union Health Secretary Rajesh Bhushan held a meeting with officials from 12 worst-hit states in India. The Union Secretary further presented a five-fold containment strategy to bring the situation under control. The states and union territories have also been advised to focus on stringent containment and public health measures in 46 high-burden districts. These are the districts that have contributed 71% of the cases and 69% of related deaths this very month. India's overall case count is now nearing the 12 million mark, while more than 160,000 people have died due to COVID-19 in the country.
The government has revealed that the country's real COVID-19 death toll is 60% higher than the official data released earlier. It is now being said that more than 321,000 people died due to COVID-19 in Mexico. The number before stood at a little over 200,000. Mexico's testing rate is very poor and doctors are overwhelmed with the rise in hospitalization. As a consequence, many Mexicans have died at home without getting tested. These people who died due to COVID-19 before getting tested are not added to the official data released by the government. This data is known as excess deaths. In Mexico, over 70% of the total excess deaths were COVID-19 related. After reviewing death certificates, the government has released the latest death toll, and the United States has the highest COVID deaths across the globe, which is followed by Brazil, but latest data has now pushed Mexico at the second spot, beating Brazil. However, Mexico's population is far smaller than either of those countries to compare with. The new report also confirms just how deadly Mexico's second wave in January was. The excess deaths estimated at the end of last year jumped by 75,000 within the first month and a half of this year. As Mexican medics reel, the days ahead will be crucial for the government to get the pandemic under control.
The Dubai government has reiterated its efforts to maintain high levels of protection against the COVID-19 pandemic and ensuring full compliance with preventative and precautionary measures. Reacting to a story by the Associated Press about the COVID-19 situation in Dubai, the Dubai government's media office issued a statement rebuffing AP's claims. Dubai has started a massive free vaccination campaign with more than 120 vaccination centers set up across the emirate, and several more centers will be set up in the coming weeks. The UAE has so far administered 2 million COVID-19 vaccine doses, covering a fifth of its population. UAE authorities are set to further speed up the vaccination campaign. The death rate in the UAE is 0.3%, making it one of the lowest COVID-19 death rates in the world, thanks to the highly advanced and well-staffed healthcare infrastructure. For more information about what the UAE is doing to combat the COVID-19 virus, log on to gulfnews.com.